Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin momentarily. We will take questions submitted by members of the media after he makes brief remarks, and I'll turn it over to Dr. Alex Garza.
Okay, thank you and good afternoon, everybody. Thanks for tuning in for today's briefing. So as we enter February, it's worth noting where we stand overall as measured by a few key metrics. Now, we had said all along that winter was going to be a really hard part in the pandemic, and that's proven to be somewhat true. So this time is a good time now to assess where things stand. Now, in December and January, although the numbers are coming down, overall the census numbers were very high in December and January. And I think everybody realized just how stressed the healthcare systems were and continue to be, but the numbers are continuing to trend down. And although they are trending down, we're still at a very high level, and so that's not something to be taken lightly at all. Now, the progress in hospitalizations that we've seen over the last few weeks have been real, and they are important. But again, we can't take these for granted. So over time, we've gotten much better at doing things like we've done during the course of the pandemic with treating patients. But we've added another tool to our toolbox, and that's of vaccines. And we've made important progress with vaccinations as well since that date in December when we started vaccinating healthcare workers and long-term care and nursing home patients. And over time, we've gotten better at how to run these clinics and supplies and all of the other things that go along with vaccinations. But we have to be clear about one thing, and that is that the falling number of cases isn't just primarily due to vaccinations. It is part of it, no doubt, particularly with the long-term care and the nursing home patients who, as we all know, are very vulnerable to the virus. But it's also been because of focus from the community in doing all of those things that we've been talking about for close to a year now, such as wearing a mask and avoiding groups and staying socially distant. And that's really important that we continue to do those things. And the reason for that is because, as we all know, the vaccine is still in scarce supply. And it's going to take some time before we can get large numbers of the population immunized. Now, today, the state released details of a plan to get as much vaccine as possible to healthcare systems that have a capacity for vaccinating large numbers of people. So starting now, a little bit over half of the vaccine doses that Missouri receives from the federal government is going to be distributed to select hospitals across the state. Now, the healthcare systems that are part of the St. Louis Metropolitan Pandemic Task Force will be part of those what are called high throughput distribution centers. Now, the healthcare systems do have plans in place now to deliver vaccine to those people who need it most urgently and as quickly as possible. But one thing to keep in mind is that supply is still not going to meet demand. There's still not enough vaccine to go around. With the current supply of vaccines, and the hospitals in our region, Region C, which you can see here on the map, is still not going to have enough. And that will make it hard to sufficiently increase the rate of vaccinations so that we can get to that magic herd immunity. Now, we expect vaccinations to be that long-term solution, and hopefully production will increase, and if the Johnson & Johnson vaccine does get through FDA approval, then we'll start seeing more and more vaccine come onto the market. But in the near term, we're still limited on the amount of vaccine that we're going to be having available for the population, and that means we still have to prioritize to those that are most at risk for poor outcomes from being infected. So the reason why I'm saying all of this is we've still got a long ways to go. So at least for the next couple of months, if not longer, the best things that we can do for ourselves, for our families, for our neighbors, for our community, is to take the virus just as seriously as ever, and to do all of those really important things that we've been doing as I said, for close to a year. And particularly with those new variants beginning to circulate now, it's even more important until we can ramp up the vaccination capacity. Now we'll have some more discussion and some more, we'll be able to talk more about planning for vaccination a little bit later this week, because right now we're still trying to digest all of the information that's coming in from the state. But be that as it may, we will be able to get vaccine into the arms of people as quickly as possible with the systems that we have set up right now. So let's go ahead and move on to some of our data now for hospitalizations. And as always, we start with our new hospital admissions. So our daily admission number now is 59, which is, again, continues to trend down. And remember, this is delayed by 2 days. And our 7-day moving average now is at 63. And again, that continues to trend down as well. Moving on to our hospital census, today we're reporting 496 patients hospitalized with confirmed COVID. Now, in putting that into a little bit of perspective, the last time that we were below 500 was right around 3 months ago. And so we're continuing that downward trend, which is good, but still have a lot of people in the hospital, still have close to 500 people in the hospital. And so we still need to have a healthy respect for the virus. The moving average now is at 534 for the 7-day moving average. Doing a little bit of a deeper dive into our numbers, as I reported, we had 496 patients hospitalized with COVID today. 101 patients with COVID are in our intensive care units, and 75 patients with confirmed COVID are on ventilators today. Now we'll take a look at our suspected COVID patients. Again, those are patients who are waiting for a test result to come back. Today we're reporting 44 patients hospitalized with suspected COVID. We have 2 suspected COVID patients in our intensive care units, and we have 2 suspected COVID patients on ventilators today. Moving on to our good news slide, yesterday we discharged 55 patients from our task force hospitals, and that brings our cumulative total up to 17,829. And again, a big thank you to all of our healthcare workers and all of the staff who have helped these patients get well enough to get home to their family and friends. Unfortunately, we still are seeing some deaths, although they have come down as well. And so I think, as everybody knows, when we start seeing declines in admissions and patients in the intensive care unit, then we'll start seeing declines in deaths. So today we're reporting 6 COVID deaths, inpatient deaths from our task force hospital. And that brings our 7-day moving average to 11 deaths per day. So again, continuing to trend down, which is good news. And again, just to reiterate that the deaths, whenever admissions go down, the ICU admissions will go down and the deaths will go down. But it all starts with the cases. So whatever we can do to limit spread and limit people getting sick in the first place really breaks that chain. Since it's Monday, we do show our updated models from the week prior. Remember, these are updated every Thursday. And so we'll briefly go through these. You can see that we didn't change our model this past week because it was trending along with what our predictions were going to be. But you can see here that the updated model does show a steeper decline than where we were 2 weeks ago, which is good news. And you can see here that it is in between our best guess line and our lower estimate. So again, we're trending a little bit lower than where our best guess was, which is also good. But we still have quite a few patients in the hospital, so although we're trending in the right direction, we always want to be wary of that. That matches with the COVID cases, so these are people that are testing positive out in the community, which shows a decline really across the metropolitan area. There's no real areas that we have identified that are seeing an increase in the number of cases. Almost every county in the MSA is seeing a decline, which is good. And across the metro areas, across the state, this is a trend as well. And so most of the major metropolitan areas across the state are seeing similar declines. Now, some are going at a faster rate than others, but overall, most of the major metropolitan areas are declining as well. And then, as we've talked about before about the reproductive number, I'll get to that in these next couple of slides. Reviewing the scorecard as well, a couple of things that I wanted to highlight here, and this is really one of them. This is our percentage of patients that are occupying beds. And as you no doubtly followed, there were times where we were well above that red region, above that 20% mark for both our intensive care unit beds as well as our total inpatient beds. And these have both dropped below that red line. So they're both in still that yellow area, with the total beds right on the brink of getting down into the green area. They're 11.5% right now. But the intensive care unit beds have dropped below that 20% mark as well. And so that's good news, because that means it's giving some relief to our healthcare workers who have been working so hard throughout this pandemic. As I mentioned, our admissions continue to decline. So again, we're at that 7-day moving average of 63, still above our red line, but it is coming down. Our prevalence continues to drop as well. So if you remember a couple of months ago, we were about double where we are right now. So we're at about 5.2 right now per 1,000 people. Still a lot of people out in the community that have the virus, but it is coming down. And our weekly change in reported new cases is reflecting this as well. So remember, it's comparing the most immediate 14 days to the prior. And so if your immediate 14 days are decreasing, then that number is going to be green. And so that is trending down as well, so 17.5%. And more good news, our testing is dropping down as well. As you remember, it was getting up into those mid-20s, but now it's down to 12.6. And again, this is reflective of the healthcare systems data, so it doesn't include the public health data or the other testing centers. This is strictly healthcare systems data. But again, getting close to that 10% mark, so that's good news. And then the reproductive number that I was talking about earlier, a little bit easier to see this here graphically. We did drop down to that 0.8 mark, and it has trended back up slightly. So right now we're reporting around a 0.9. And remember, we want to keep that below 1 to interrupt transmission of the virus. And so, again, doing everything that we need to do to prevent spread of virus until we can get large percentages of the population vaccinated. So in summary, we're making a lot of progress, but there's still many challenges that are out there, and we can't let our guard up right now. Now, we're going to be continuing to preach caution and prevention, and I also want everybody to recognize and keep in mind that the small businesses that are impacted by this pandemic, and so please do whatever you can to help them out as well. Ordering curbside takeout, we know that there's now extended hours and some indoor dining, so please help them out as much as you can. And they're going to need your help during these winter months more than they have in the past. And hopefully, spring is a couple of months away, so we still have some cold weather to get through. But let's see what we can do to help support them make it through till we get warmer weather and get more vaccine. And so that'll conclude my remarks, and now we'll take some questions from the media.
You referenced earlier in the news conference the changes in vaccine distribution. How much of a change will this mean for our local hospitals' vaccine supply, and is this a significant increase?
Yeah, so it's hard to answer the significant increase question, and the reason for that is because the doses that were shipped to the healthcare systems over the past month and a half have varied from week to week. And so, on some weeks you could end up getting, just making this up, 6,000 doses, and the next week you could end up getting none. And so it's a little bit difficult to say whether it's going to be more or less, just because it was such a variable number. But what it does do with this new plan is it does give us some certainty on the number of doses that we're going to receive, which is very important. And the reason for that is because it makes it very challenging to schedule vaccinations for those high-risk populations unless you know how much vaccine you're going to be getting on any particular week. So as you can imagine, what you would hate to do is schedule vaccinations and then find out that you're not getting any vaccine. So with this new distribution plan, it helps us with a little bit more certainty on how we can go about scheduling the vaccinations. We are going to be operating as a task force to understand how many vaccinations are going to be allocated to each of the healthcare systems, and we're all working together on that. And so, there'll be some adjustments made as we go along. But again, the important point to stress is that it brings certainty to the system, and that is really the important part. Now, obviously, we'd like for there to be more vaccine, but absent that, the certainty and the quantity is very important.
What are local health leaders doing to ensure mass vaccination rollout goes smoothly and that people who should be getting vaccinated first aren't cut by people who don't qualify?
Yeah, so as far as the mass vaccination clinics go, those are typically put on by health departments and the National Guard, the two major groups that are doing those here in the metropolitan area. And so what should be happening is the pre-registration for vaccinations, and through that pre-registration process, then you're able to determine who should be prioritized for a vaccine. And so, as most people know, it's that over 65 years old and those with chronic health care conditions. And so there should be some ability to check one of those conditions to make sure that people are appropriately getting in line. The healthcare systems have a little bit of an advantage because most of these people are patients of ours, and so we can easily look through our patient records and identify age and identify chronic conditions. And so that's why our scheduling systems, we can book those out, sending invitations to patients to come in and be scheduled. On the public health side, you're basically saying you're trusting that the people that are putting in information are being true, and so that's part of the challenge with that. But it should all filter through that pre-registration site, and then making sure that people that are signed up are who they say they are and are meeting the requirements.
That concludes our list of questions received prior to today's briefing. Thanks for watching.